Anticoagulant medications are used to prevent blood clots from forming. These medications work by interfering with the normal function of plasma proteins called coagulation factors, which take part in secondary hemostasis, where hemo refers to blood, and stasis meaning to halt or stop. In this video, we're going to focus on heparin, which works by indirectly inhibiting two clotting factors called thrombin and factor X, by binding to and enhancing the activity of an anticoagulant protein called antithrombin 3. Now, before we discuss heparin in detail, we need to talk about the coagulation cascade, which is where heparin exerts its effect. The coagulation cascade starts via two pathways, the extrinsic and intrinsic pathways. The intrinsic pathway starts when circulating factor 12 comes into contact with the surface of activated platelets, or collagen. Activated factor 12 then activates factor 11, which activates factor 9, which activates factor 10. Factor 10 starts the common pathway where it activates factor 2, or thrombin, which activates factor 1 that builds the fibrin mesh. When factor 2 gets activated, it also activates four other factors, 5, 8, 9, and 13. Factor 5 gets activated and acts as a cofactor for 10. Factor 8 acts as a cofactor for factor 9, and factor 13 helps factor 1, or fibrin, form crosslinks. In the extrinsic pathway, exposed tissue factor activates factor 7, which activates factor 10 and starts the common pathway. Now, the most common point of clot regulation is when a coagulation factor called thrombin is produced. Thrombin, or activated factor 2, is a very important clotting factor because it has multiple procoagulative functions. Think of thrombin as the accelerator on a car, the pedal that takes secondary hemostasis from 20 miles per hour to 100 miles per hour. First, thrombin binds to receptors on platelets and causes them to get activated. Activated platelets change their shape to form tentacle-like arms that allow them to stick to other platelets. Second, thrombin activates two cofactors, factor 5, used in the common pathway, and factor 8, used in the intrinsic pathway. Third, thrombin proteolytically cleaves fibrinogen, or factor 1, into fibrin, or factor 1a, which binds with other fibrin proteins to form a fibrin mesh. And finally, thrombin proteolytically cleaves stabilizing factor, or factor 13, into factor 13a. Factor 13a combines with a calcium ion cofactor to form cross-links between the fibrin chains, further reinforcing the fibrin mesh. Since thrombin is so crucial to coagulation, it makes sense that it serves as the main target of antithrombin 3, which is one of the body's anticoagulation proteins. Now, antithrombin 3, sometimes just called antithrombin, is a protein made by the liver and released into the blood, where it binds both thrombin and factor 10 in the common pathway. The thrombin in the blood can bind to antithrombin and become unavailable. Antithrombin also binds to active factor 10, which is a pivotal coagulation protein that converts prothrombin into thrombin. Antithrombin also inhibits factor 7, 9, 11, and 12, although with much less affinity. Heparin is a carbohydrate molecule with a pentasaccharide chain followed by a tail made of glycosaminoglycans. Heparin can be unfractionated or fractionated. Unfractionated heparin refers to heparin derived physiologically, usually from pig intestine, and is a mixture of high molecular weight heparins, or HMWH, as well as low molecular weight heparins, or LMWH. HMWH has a longer glycosaminoglycan tail, while LMWH has a much shorter tail. Fractionated heparin is created when unfractionated heparin undergoes a process where the HMWH gets depolymerized, meaning part of their tail gets chopped off, so it only consists of LMWH. The length of the tail is crucial for the function of these two types of heparin. Both high and low molecular weight heparins can bind to antithrombin 3 via the pentapeptide region, which causes it to increase its activity in inhibiting factor 10. However, in order to increase antithrombin 3's activity against thrombin, the thrombin needs to bind to the long tail of the heparin, meaning only high molecular weight heparin has an effect on thrombin. Compared to unfractionated heparin, low molecular weight heparin like enoxaparin and dalteparin have better bioavailability and have a 2 to 4 times longer half-life. Additionally, low molecular weight heparin does not require laboratory monitoring because it does not affect thrombin. Another medication that shares these features is fondaparinux, which is a synthetic molecule similar to low molecular weight heparin, but only contains the pentasaccharide chain. Heparin is administered intravenously or subcutaneously to people for short-term anticoagulation, and immediate anticoagulation because of its rapid onset, usually within seconds, and chemical makeup. Because of its direct route into the blood and immediate anticoagulant effects, it's used for many acute problems. In fact, it's the medication of choice during an acute deep vein thrombosis, preventing post-operative deep vein thrombosis and pulmonary embolism, maintaining extracorporeal circulation during open heart surgery, and renal hemodialysis. Warfarin can be taken perorally, so it's the drug of choice for chronic management since the person can take the medication home. Since heparin primarily operates on factors in the common and intrinsic pathway, a laboratory value called the APTT, or activated partial thromboplastin time, is used to measure its efficacy. The APTT measures the speed at which blood clots via the intrinsic and common coagulation pathways. To perform this test, blood is drawn from a person and placed in a test tube. Next, the sample is separated by centrifuge into plasma, which contains the coagulation factors. Next, a contact activator, like silica or cellite, which mimics the surface of a platelet, gets added to the sample to trigger the activation of the intrinsic pathway. The time until the sample coagulates gets measured. A normal APTT is between 30 seconds and 40 seconds. The APTT is approximately 50 to 90 seconds, or 1.5 to 2.5 times the person's baseline value. If a person was given too much heparin, then the APTT can rise to values greater than 100 seconds, and the person might suffer internal bleeding. In these situations, a reversal agent called protamine sulfate can be given, which binds to and inactivates circulating heparin. Another toxicity to be aware of is called HIT, or heparin-induced thrombocytopenia. Thrombocyte referring to platelets, and penia meaning small or little. So thrombocytopenia means low platelets. Heparin binds to a protein on the surface of platelets called platelet factor IV. This complex is immunogenic, meaning it can cause the immune system to produce proteins called antibodies that target the complex for destruction by cells called macrophages. The result is a low platelet count and an increased risk of bleeding. If HIT happens, the heparin should be stopped and the person switched to a different anticoagulant, like direct thrombin inhibitors, which includes medications like argatroban, bivalirudin, and dabigatran. Other toxicities associated with heparin include an increased risk of osteoporosis, as well as interactions with other medications that enhance anticoagulation like aspirin, ibuprofen, and warfarin. Heparin has been known to have decreased anticoagulation effects with medications like digitalis, tetracyclines, antihistamines, and nicotine. Alright, as a quick recap. Heparin works by lowering the activity of two clotting factors called thrombin and factor X by binding to and enhancing the activity of a protein called antithrombin 3. Heparin can be unfractionated or fractionated, which is also called low molecular weight heparin. Unfractionated heparin inhibits both factor X and thrombin, while low molecular weight heparin only inhibits factor X. Both types are utilized for short-term immediate anticoagulation for diseases like acute pulmonary embolism, deep vein thrombosis, as well as surgical prophylaxis. Heparin's main toxicity profile includes its increased risk of bleeding, HIT, and osteoporosis.